Good morning, everyone. Today's topic is pulpotomy. It is a procedure, according to PHRAIM, a complete removal of the coronal portion of the dental pulp, followed by a placement of a suitable dressing or medicament that will promote healing and preserve the vitality of the tooth. Now, as the definition says, the complete pulp in the coronal portion of the root of the tooth is taken out and the pulp stumps are left as such, and medicament is placed over the pulp stumps so that the pulp can heal in that region and remain vital without having any bacteria in that area, and the tooth will remain vital for all purposes. So that medicament that we place should be a biocompatible medicament. It should not cause it should not have any caustic reaction with the pulp tissue, and it should promote healing. All this will cause the tooth to regain its vitality, and we don't have to do any instrumentation for this into the root canals. The indication, there are mostly two indications. The tooth should be vital. The pulp exposure in the primary tooth due to trauma of short duration is usually an indication for pulpotomy. Mechanical exposure of the pulp during cavity preparation or excavation of caries. Anticipating pulpal exposure with the removal of the diseased dentin. Now, the pulp should be devoid of infection when you are thinking of a pulpotomy procedure, because if it is a deep cavity and there is an anticipated pulpal exposure, the chances are that a little bit of toxins of the bacteria would have entered into the pulp chamber. And that is not an indication for pulpotomy, because we don't know how far deep into the pulp chamber the infection or the acidity or the toxins would have reached and caused damage to the pulpal tissue. So exposures of short duration is what is indicated when we think of a pulpotomy technique. Contraindication: it should not have any history of night pains. The tooth in question should not have any history of abscess or swelling, history of spontaneous pain, relieved only on medication. The pain at night, that is a pulpitis pain, which is relieved only with medication. Sharp shooting pain, again, is contraindicated for pulpotomy. X-rays showing any interradicular loss or interradicular changes or furcation involvements or periapical radiolucencies are contraindicated for pulpotomy. Any signs of external resorption, internal resorption, or root resorption is also indicated for contraindicated for pulpotomy technique. There should not be any tenderness or perfusion, and pathological mobility also should not be done. Should not be there for the tooth in question where you indicate a pulpotomy technique. The advantages are radicular pulp vitality is retained, which means the tooth remains vital even after the treatment is done. The removal of the infected pulp has been done, so the rest of the pulp will be uninfected, it will remain vital. We are not entering into the root canals at all for this procedure. So that is an advantage, because we have the permanent successors underneath, and those permanent successors can get injured if there is over instrumentation during pulpotomy technique. So that chance is not there when you're doing a pulpotomy technique. No chances of injury to a subsidiary tooth. The procedure is simple and easy. It can be done in one sitting, and for the permanent restoration, they have to come one more time. So it is much easier to do. It is not complicated. It's not time consuming. Pulpotomy can be attempted if procedure fails. Now, if this procedure is not a success, you can always go in for a pulpectomy technique later on. Disadvantages is selecting the case is very, very important for success. There should be, you should take a thorough history of the tooth in question before you do a pulpotomy technique. And as I told you, the exposure, if it is there, it should be a very short duration. And another disadvantage is the local anesthesia has to be administered, which in the case of children, it is not very accepted. Classification, there are 4 types of pulpotomy techniques. It's classified according to the material that is used as a pulpotomy medication. So we have the devitalization technique, we have the preservation technique, regeneration technique, and the mortal pulpotomy. I will tell you the procedure first, then we will go into the details. The procedure is we have to anesthetize the tooth. If it is a lower molar, it has to be, a block has to be given. The inferior alveolar nerve block has to be given. If it is a upper tooth, posterior or anterior infiltration or a block can be given. Rubber dam isolation is a must, because sterility is another reason for the success of this procedure. Remove all the caries, remove the dentinal wall or roof of the pulp chamber with slow speed handles. Now all the caries should be removed, the tooth should be irrigated with saline to remove all the debris that is there before you enter into the pulp chamber. And then you can use a slow speed handpiece or a sharp excavator to remove the roof of the pulp chamber. And once the roof of the pulp chamber has been removed, you find the pulp there inside. So excavate the pulp, excavate all the pulp with a sharp excavator. Clean the chamber with saline, dry it with sterile cotton pellets, control the bleeding, and then after that, you apply a cotton pellet which is soaked in formiclosol to the pulp stumps for a minimum of 1 minute, and then remove the cotton pellet. After removing the cotton pellet, make sure that the canal is dry, fill the chamber with the restorative material. Okay. And the temporary restoration is done. After this, the patient is recalled after 4 to 6 weeks. A radiograph is taken to see if there is any sign of periapical radiolucencies, periapical pathology, and then restore with a permanent restorative material. And this has to be followed up with a stainless steel crown or a zirconia crown if the tooth is symptomless. This is a diagrammatic representation of a tooth which might need pulpotomy or pulpectomy. If you can see that the cavity is very, very close to the pulp, since X-rays are two-dimensional in nature, there are chances that what we see in the radiograph may not be exactly what the clinical picture is. Now, once you have chosen the tooth for the procedure, the pulp chamber, as you can see, you have anesthetized the tooth, you have isolated it with a rubber dam. There is the roof of the pulp chamber is intact. We have cleaned up the chamber. All the caries has been removed and saline irrigation has been done. After that, the debris has been taken, soft debris has been taken out. Now there is an intact roof of the pulp chamber. Take a soft, slow speed handpiece and take off the roof of the pulp chamber. Now, once the roof of the pulp chamber is taken out, the pulp will be visible in the pulp chamber. Excavate the pulp from the pulp chamber using a sharp excavator. Go along the margins of the cavity and sever off or cut off the pulp at the pulp canal orifices. The bleeding has to be stopped, and the pulp stumps will be left as such. It will be sterile, You can even use a slow speed handpiece to remove the pulp from the pulp chamber, but it is safer to use a spoon excavator because it is that way you are ensuring that the pulp does not get pulled out from the root canals. Now this is how the tooth would look after the pulp has been excavated. The root canal pulp is visible in these areas. This is the furcation area where you can see there is no pulp. It is very clean, no debris is present, and the bleeding has been stopped. It's all under sterile conditions. Then a formicrosol which is soaked is a cotton pellet which is soaked with formicrosol is kept in relation to the pulp stumps for a period of 1 minute, and then the cotton pellet is removed and the temporary restoration is given. Now, in some cases, what happens is it is difficult to obtain stopping of the bleeding. You can see the pulp stumps are a little hyperemic, and it is oozy, and it is difficult to control the bleeding. Now, in such cases, what we do is retain that formicrosol pellet in the pulp chamber itself, keeping it in close contact with the pulp, and then a temporary restorative material is given. This is a cotton pellet which has been kept soaked in formicrosol that can be kept in the chamber, and a restoration can be given. If it is a single sitting pulpotomy, the cotton pellet is removed and restoration is given. And if it is a double sitting, 2 sitting pulpotomy, we retain the formicrosol pellet in place and then give a restorative material. The patient is recalled after 4 to 6 weeks. Now, in a single sitting pulpotomy, if you find that there are no radiopaque changes in a radiograph, no radiopaque changes, no clinical findings are seen, you can go ahead with a permanent restoration, and that can be followed up by a stainless steel crown. Now, some of the materials that are used for pulpotomy are formicrosol, glutarialdehyde, BMP, it is bone morphogenetic protein, mineral trioxide aggregate, freeze-dried bone, zinc oxide usual, enriched collagen, osteogenic protein, ferric sulfate, freeze-dried bone, ferric sulfate, laser, electrosurgery. Sweats pulpotomy. This is done in permanent tooth. This is the same as that of a primary tooth. Local anesthesia has been given and has to be done. The pulpotomy is the same as that of the primary tooth. The isolation has to be done, and you can partially take off the pulp from the pulp chamber in Sweats pulpotomy. Or if you feel that a little more of the pulp has to be taken off, you can take out the pulp from the pulp chamber, all the pulp from the pulp chamber, and then calcium hydroxide is given as a medicament instead of formicrosol. Calcium hydroxide induces secondary dentin formation, and the root completion is continued. Now, this is usually indicated in cases where the root formation is not complete and the tooth has hypoxogenesis.